Sometimes the answers we need are hidden deep within a single cell. At Premier Hospital, our new histopathology service brings those answers to you faster and with greater accuracy than ever before. From early cancer detection to guiding treatment, every sample we analyze is a life we are helping to protect. I am so proud to be part of this new chapter where science, speed, and compassion come together. See it all at our grand lounge and experience healthcare that truly cares.
CT scan can sound scary, but at Premier Hospital, we make it smooth, safe, and even comfortable. You lie on a soft table, slide into the scanner, and in just a few minutes, we'll get incredible detailed images to help your doctor treat you better. Our new 128 slice CT is faster, more precise, and open 24/7 without any emergency charges. Need a CT scan? Walk in or call us today. We are ready for you.
When we operate, everything matters, and those details start here with clear diagnosis, accurate images that guide every decision. Our new 128 slice CT scan gives us sharper, faster diagnostics so that we can act sooner, plan better, and care for you more effectively. This is more than a technology. It is a promise of safer surgeries, faster recoveries, and better outcomes. Join us at the grand launch because your tomorrow starts with the right diagnosis today.
Complicated condition. Our imaging tools are not just diagnostic, they are life-saving equipment. Don't wait too long. Early care is better care. Visit Premier Hospital for give you clarity and peace of mind. Karibu Premier Hospital.
I am Dr. Nigel Steve Amolo. I am a thoracic and cardiovascular surgeon who is working here in Mombasa. So we have just completed a case, an interesting case, a vascular case, a patient who had something called aortic aneurysm. Basically, aortic aneurysm is a bulging of the aorta in our body, and it's a case that we have handled here in this hospital. It's the first of its kind case we have handled in this hospital. So just to tell you about this case, we have done an elderly man who, it's usually an incidental finding where we have the aorta. Aorta is like the biggest artery in your body. So sometimes it can actually swell, and this swelling is what we call the aneurysm. So we can have it swelling in different points. We have it either in the thoracic region, this way in the chest, or in the abdomen. In the case that you have just handled, this was a swelling in the abdomen. And the reason why we have to do the surgery is the swelling can be, it's like a balloon which has swollen and the wall becomes weak, and the patient can be at risk of rupture, or if it ruptures, there will be severe severe bleeding which can lead to death. So we did handle this case here, and it has gone well. We have actually finished it okay, and the patient is being taken to the ICU. So just to dwell on this case, some of the risk factors to have aortic aneurysm is like smoking is a risk factor. Just being male, we are more like 4 to 6 times more at risk to get aortic aneurysm than females. Then if you have a family history of someone who has a similar disease, you are also at a higher risk to get it. And there are some conditions that if you have, you're at a risk of having aortic aneurysm. If you have some of like infective symptoms like syphilis, TB can also cause that. If you have atherosclerosis, this is where you have your blood vessel is being narrowed and also having some hardening plaques that are forming in the blood vessel. So this causes the artery swelling, and you can actually lead to aneurysm. Also, which if somebody has them, you have a higher risk of developing this kind of disease, like the ones who have Down syndrome. So it's usually an incidental finding when you're looking for something else, and then maybe an ultrasound being done on you, and then they get the aorta actually swollen more than normal. And this one, you can actually look at it conservatively. The other thing that is of note for this kind of a condition is when you have this swelling, the aorta can actually split. The split, we mean that we call it dissection. It's where the walls they split, and then the blood is moving through the walls. And this usually causes some severe pain, and this now comes in as an emergency. Or also we can have even a slow leaking. There's an area which can actually start, the blood starts leaking out of the blood vessels, and we have to do it as an emergency. So basically what we do, we actually replace, depends with the modality of surgery.